Good morning or afternoon, everybody. Welcome to the Building Healthy, Equitable Communities, a training series from ChangeLab Solutions. This is a virtual space to explore the elements of a just community and the conditions that will help all children and families thrive. Back in April, we began releasing collaborative episodes which offer training and discussion on how policy plus community power can advance health equity. You can see the full schedule and our 6 episode topics here on our series homepage. Our kickoff episode explored health equity as a principle and a practice and set a high-level theoretical framework for how to use law and policy to advance health equity. In subsequent episodes, we laid out legal and policy opportunities for operationalizing health equity, including paid family and sick leave, equitable procurement policies, comprehensive long-range planning and place-based strategies, and restorative practices in schools. All of these episodes are now up for viewing on our website, and you can see the address there on the top right-hand corner of your screen. Today, we're going to discuss preemption, an essential concept for policymakers and equity advocates to understand. And just like the previous episodes, this will be recorded and posted on our website, so you can come back to view today's slides in case you miss anything. We're very happy to have you all with us to discuss this important topic, and we have a wide range of sectors represented in today's audience, from public health professionals to social service providers, folks from healthcare institutions, and staff from all levels of government, and more. So you can put a face to the voice. I'm Sabrina Adler. I'm an attorney here at ChangeLab Solutions, where I work primarily on legal and policy issues related to healthy children and families, sugary drink and food marketing, and local democracy. Before joining ChangeLab Solutions, I worked in child care law and policy and as a legal aid attorney at a medical legal partnership. On today's webinar, I'm going to be joined by 2 of our partners, Kim Haddow of the Local Solutions Support Center and Miya Saika Chen of the Partnership for Working Families. Kim is the director of the Local Solutions Support Center, an organization formed to coordinate and create opportunities to counter preemption that hurts local democracies and communities. As president of Haddow Communications, Kim has worked with the Rockefeller Family Fund over the past 6 years to pass earned sick day laws in over 40 states, cities, and counties across the country. She has a long and successful history in communications, and we're thrilled to call her a partner and a friend. Miya Saika Chen is an attorney at the Partnership for Working Families, where she provides legal assistance to grassroots organizations across the country to help them increase the economic power of low-income communities of color and women. I'm thrilled that we all get to gain insights and lessons learned from Kim and Mia's deep expertise in this space. A quick disclaimer, ChangeLab Solutions does not enter into attorney-client relationships, and none of this presentation is considered legal advice. During today's webinar, we're going to talk about preemption, which is a wonky word that hopefully we will fully unpack by the end of the hour. I'm going to quickly provide a definition so we're all on the same page, and then Kim will walk us through the wave of preemption that's swept the country over the past several years. After Kim, I will jump back in to talk about the relationship between preemption and public health, as well as the relationship between preemption and health equity. Then I'll turn it over to Miya, who will talk about some of her research and work on the effects of preemption on racial and gender justice. And finally, we'll hear from Kim again about messaging and resources. We do plan to have time at the end to answer questions, so please feel free to use the chat box to submit questions at any time. So first, a brief overview of the concept of preemption so we are all on the same page. As you probably know, according to the U.S. Constitution, government authority in the U.S. is divided between the federal, state, and local levels. Under the Constitution's Supremacy Clause, federal law takes precedence over lower-level laws. With regards to state law and its relationship to local law, states can choose how much, if any, of their police power, and that's the power to regulate behavior and entities to ensure people's health, safety, and general welfare, that they'll share with local governments. So the degree to which local governments have this police power varies a lot by state. So what is preemption? At its core, preemption refers to when the law of a higher jurisdiction limits or even eliminates the power of a lower level of government to regulate a certain issue. That can be federal law with respect to state or local law, or state law with respect to local law. So now I'm going to turn it over to Kim to talk about what's happening right now across the country with respect to preemption.
Thanks, Sabrina. I wanted to start with a conversation briefly about folks. Many of you on the phone already work in public health and are familiar with different types of preemption. So in the 80s, we saw a whole spate of local tobacco control ordinances that were promoted by the tobacco industry. And in the 90s, we saw similar activity from the gun lobby and from the National Rifle Association, again, using preemption to make sure that localities were not regulating tobacco products, and guns. But what we have now is something quite different. We call it new preemption, and it is different, and I'm going to use a definition from one of the law professors we work with at the Local Solutions Support Center. We are now looking at sweeping state laws that clearly, intentionally, extensively, and at times punitively bar local efforts to address a host of local problems. You know, often these preemption laws are propelled by trade association and business lobbyists. And right now what we're seeing actually is not just a whole new wave of preemption and the misuse of preemption to tie localities from regulating, but actually what we are seeing is the use of state preemption to end regulation around a policy altogether. So one of the things that's been happening since 2011 is the quantity of preemption laws have skyrocketed. Half of all the states now preempt local minimum wage laws. 22 states now preempt local sick days laws. 41 states ban local regulation of ride sharing. 43 states limit local authority to regulate guns. We also have 20 states and a growing number of states that have banned local control over 5G technology. And we just saw last week the federal government through the FCC preempt the states from regulating 5G. So, end of the day, we're seeing the quantity of laws skyrocket. We are also seeing the state interfering in a broader swath of public policy laws than we've seen historically. So we now see preemption bills restricting local regulation of labor standards, public health and safety rules, civil rights, taxing and revenue, 5G and broadband, environmental protection, and local zoning. Traditionally, a historically core power of cities. We're also seeing something very new since 2011, which is the use of preemption to overturn ballot initiatives. This is where, in places where policies are already preempted, advocates are going to the ballot in an effort to secure and to advance these policies. And what we're seeing in more places, as you can see here, is actually the legislature coming in and preempting the outcome of a popular election. Preemption is also being used to perpetuate inequity. My colleague Miya will talk more about that during her presentation, but what we are seeing is the use of these laws to actually stifle the ability of majority cities to move forward, to use policies that would lift them out of poverty or to keep their populations safer or healthier. Preemption bills have also become more punitive, wider in scope, and more hostile to home rule. So when we talk about punitive preemption, this is really a distinguishing factor between historic use of preemption and the current misuse of preemption we're seeing. And basically, the punitive aspects of these new laws fall into two categories. One of them has to do with punishing cities themselves. So basically, cutting off state funding to localities that pass policies or try even to pass policies that the state disagrees with. And then we also have a new wave of punitive provisions that go directly to elected officials and punish them for doing their jobs, basically, for voting, for speaking out, for representing their constituents. And these punishing provisions take the form of penalties, fines, removal from office, and in some places, jail time. We are also seeing blanket preemption. And basically what that means is that the cities, the goal is to have the cities not regulate businesses at all. So we've seen a few bills, not too many in the last session, but in 2017, particularly in Florida, we saw a bill that would have just basically taken cities out of the business of regulating business, period. The other thing we're seeing more of is what we call the Death Star, which means in one sweeping bill, a multitude of usually wage, benefit, workplace provisions are wiped out. That started in Michigan in 2015, and we have seen a lot more of it since then. The other thing to remember about this new preemption is that it's ideologically driven. It really is about reducing, restricting, and prohibiting local regulations. And we saw this trend continue in 2018. We saw a Wisconsin Death Star bill passed. We're fighting one in Pennsylvania right now. Tennessee and Iowa both passed sanctuary city bills that included punitive preemptions, cutting off state funding to cities that move forward as a welcoming city. We also, again, saw the Arizona preempted Tempe's ballot initiative that would have required the disclosure of campaign donations, a measure that passed 91% to 9%. Also, the traditional powers of cities are under attack. Again, what we were talking about, sort of the core functions of cities. So contracting, which has always been protected by the cities who act as contractors and as businesses, came under preemption in Arizona and Wisconsin this spring. Elections, as we just talked about in Arizona. Traditionally, this is the power to oversee municipal elections is reserved for municipalities. That was infringed upon in Arizona. And then we're seeing a spate of short-term rental laws that really do eat into the zoning authority of cities. Sabrina will talk more about this, but I think the most frightening thing we saw in 2018 was the action of the Beverage Association in California. The Beverage Association had raised $7 million to put an initiative on the November ballot that would have made it much harder for localities to raise revenue, to fund basic services, police, parks, fire, ambulance. And exchange for dropping that initiative, the legislature in California passed a 12-year ban that would prohibit localities from imposing soda taxes. We are very concerned this form of, can only be called extortion, will be replicated. We are also seeing some good signs. Cities are fighting back. They're going to court. They are organizing advocates and elected officials. Coalitions are fighting back. And one of the things we take encouragement in is a ruling that was passed by the 11th Circuit Court, ruling on minimum wage increase in Birmingham, Alabama, that had been preempted 16 days after it was passed by the majority white Alabama legislature, again, preempting the ability of the majority African-American city to raise its wages. And what we have here is a ruling that says that action may have been racially motivated. It's going back to the courts. It needs to be proven. But part of the language that came out of that ruling is a redefinition of what constitutes racism today. So, Sabrina?
Thanks, Kim. So I'm going to focus in on preemption specifically in the context of public health and health equity and talk a little bit more theoretically about some of these issues. Starting with an example of how this has played out in one area of public health. As Kim noted, tobacco control is an area where preemption has long been an issue. So a bit more context there. The tobacco industry has been pursuing preemptive legislation for many years after it became clear that it was easier to stop tobacco control policies at the federal or state level than it was to fight against policy adoption in many individual cities where local advocates were successful at enacting laws. Starting in the 90s, advocates began to push back against preemption by inserting explicit language into state laws that allowed for local regulation or by working to repeal state-level preemption laws. But as you saw from Kim's earlier map, there's still a lot of tobacco control preemption on the books, And during this recent wave of preemption, for example, industry has pushed for states to preempt localities from enacting ordinances raising the legal age to purchase tobacco to 21. That same wave has reached many other areas of public health and the social determinants of health, as Kim noted, from sugary drink taxes to environmental protections to minimum wage and more. What are the health equity implications of preemption? Let's take a step back for a moment. States, but particularly local jurisdictions, are often thought of as what we call laboratories of democracy. Local government can be a driver for positive change, innovation, and experimentation. They're the level of government that's closest to the people, so they have a connection to residents' everyday lives, their lived experiences, and can be more responsive to their needs and desires. And because of that, local governments have been able to push for a variety of policy innovations that advance health equity, whether increasing the minimum wage or guaranteeing paid leave, requiring inclusionary zoning, or expanding anti-discrimination protections. The inequities that are targeted by local governments have often resulted from both current and historical abuse of government authority to enact and preserve the very systems and institutions that, whether intentionally or not, perpetuate racial, health, economic, and social discrimination. As Kim just discussed, over the past few years, these very same government authorities, particularly at the state level, have misused preemption with increasing regularity to thwart the very policies that have been designed to increase equity across populations. So that's the equity landscape in which we're operating. In response to that reality, earlier this year, the CEO and Executive Director of the National League of Cities, an organization that we partner with frequently, warned of the dangers of preemption. So you can see here on this slide, he said, people who live in cities and towns want control over their own destinies. When states take away the ability of local leaders to make decisions, the values and will of the people are ignored. And while I very much respect NLC and agree with this statement, it's also important to remember that this type of localism is not always inherently beneficial from a health equity perspective. History has shown that unfettered localism can actually facilitate segregation and inequality and has been tied to many attempts to entrench those outcomes. So that leads me to this point. Preemption shouldn't be characterized as universally negative or inherently partisan. The mechanisms that localities now rely on for innovation are the same strategies once used to combat things like Reconstruction and civil rights. Preemptive federal laws such as the Fair Housing Act have actually served to counter government-sanctioned discrimination promoted under the guise of states' rights and local control. When we think of localism today, we don't think of this photo here. Many people are familiar with the intense backlash the nation faced when, after the Brown versus Board of Education decision, the federal government tried to desegregate schools. Enforced integration was seen by many as an overreach of federal power, leading states like Virginia to decide that they would rather close all of their schools than face integration. So the fundamental point is that preemption absolutely affects health equity, but it depends on the type of preemption and how it's used. It's very true, and I don't want to lose sight of the fact that in recent years, and even dating back decades, as we talked about with tobacco control, preemption has been and is still being used to stifle the types of local innovations that promote health and equity and that many of us care so deeply about. Kim just shared with us just how truly scary these times are. But for those of us working in the health equity space, I want to suggest that it wouldn't be right to push aside another aspect of preemption, the potentially positive aspect. I want to give a few examples. Some of you might be familiar with the case of Lakeisha Briggs. In 2012, Ms. Briggs called 911 and the police came to her house in Norristown, Pennsylvania and arrested her ex-boyfriend who had physically assaulted her. When they were there, an officer told her that she was on 3 strikes. Until recently in Norristown, if you called 911 too many times, you could get evicted from your house under the town's nuisance ordinance. And that's what happened to Ms. Briggs. Her ex continued to beat her, she continued to seek protection from the police, and because of this, she was deemed a nuisance and was ultimately kicked out of her home. The Pennsylvania State Legislature enacted a statute that expressly preempts any local ordinance that penalizes tenants or landlords for using emergency services by or on behalf of a victim of abuse or a crime. Just last month, California became what I think is the 4th state to enact this same kind of preemption. These types of preemptive laws actually advance health equity in a significant way. As another example, California has also recently passed a preemptive bill that strips local government's authority from regulating and ultimately denying certain multi-unit housing developments. The state did this to ensure that local governments could no longer avoid responsibility for a severe and worsening housing crisis. And just a few weeks ago, the governor here signed another bill taking away cities' authority to zone around BART stations, the Bay Area's commuter rail system. These laws are also preemption in action. Let's take a look at a few different types of preemption and see how they might affect health equity. First is what's called ceiling preemption. Ceiling preemption happens when a higher level of government sets standards and prohibits lower levels of government from enacting laws that deviate from those standards. Though that type of preemption could definitely have negative consequences, what types of advantages might it have? The first is uniformity. Uniform standards can also lead to efficiency, and that can be particularly beneficial in fields where having a single regulator can lead to significant cost savings. That said, the efficiency argument is often used by businesses to advance preemption that hinders equity, so I want to be careful about assuming that preemption leads to efficiency. More research is needed to determine the interplay between those two things. And finally, ceiling preemption guarantees equality. The idea here is that ceiling preemption eliminates disparities in the protection afforded to people based solely on where they live. That's particularly true for something like consumer protection laws. A law with ceiling preemption might not set the highest possible standards, but at the very least, it's ensuring that everyone's held to the same standard and no one is left behind. One example of ceiling preemption is menu labeling. The fact that there is a federal menu labeling law that preempts most state and local requirements for menu labeling is in some ways a good thing. It ensures that everyone in every state and locality has access to and benefits from the same information. That's good from an equity perspective. And restaurants argue that it makes it easier for them to comply, particularly if they operate in multiple locations. So again, I want to flag that we need to learn more about whether that argument about efficiency is in fact true. That said, it also prevents lower levels of government from experimenting in the space or from setting stronger standards, even if residents of those places want stronger standards. Contrast ceiling preemption, however, with what we call vacuum preemption. This occurs when legislators choose not to enact regulations in a particular field, but then actively forbid lower levels of government from doing so. This is the type of preemption we're seeing most commonly today. Though there are exceptions, vacuum preemption can have detrimental effects on public health efforts. Not only does it limit local efforts to address public health issues like chronic disease prevention, but it creates a regulatory vacuum by not establishing any statewide or federal standard. Finally, we have floor preemption, which some argue isn't preemption at all, though from a legal perspective, we do think about it that way. With floor preemption, the higher level of government passes a law that establishes a minimum set of requirements onto which lower levels of government can add additional or more rigorous requirements. But the lower levels of government can't enact less rigorous requirements or allow those within the jurisdiction to ignore the law entirely. One example of floor preemption on the federal level is school nutrition standards. Federal law sets minimum standards for foods sold at schools participating in the National School Lunch Program, but it allows state agencies and local school districts to impose more rigorous and/or additional nutrition requirements, and many have done so. So given all of that, including the various effects of the different types of preemption, I want to suggest that to combat inequitable outcomes, we need to be clear about the goals and not just take a one-sided view of preemption, or we might risk advocating for tools that can and have been used to undermine equity. So what should our goal be? Advancing health equity. And we should first frame a policy intervention around the advancement of health equity, and then we can assess how preemption might factor into accomplishing that goal. All of that said, I do readily acknowledge, and I have said this repeatedly and will continue to, that at this particular moment in time, as Kim emphasized, we're dealing with a political reality in which the vast majority of preemption is being used to stop progressive localities from enacting equity-promoting policies. So given that, what can we do? All hope is not lost. There are two primary means by which we can push back. The first is through the political process. While many preemption bills are pushed through quietly and at the last minute, that's not always the case. It's possible to organize and fight preemption during the legislative process, either by preventing it from being enacted in the first place or by repealing it later. That can definitely be difficult, but with increasing awareness of this issue, it's certainly possible. For example, grassroots groups in West Virginia, Pennsylvania, and Florida have successfully stopped preemption bills. And in some states, it might be possible to use ballot measures to repeal preemption. So for example, in California, a ballot measure has been proposed that would establish a statewide sugary drink tax and also repeal that preemption that Kim mentioned earlier of local sugary drink taxes. In addition, there are several legal arguments that can be used to challenge preemption laws in court even after they're passed. In many states, the powers of local government are protected by the state constitution, and certain types of preemption or preemption on certain topics could be unconstitutional. Also, the last-minute backroom way in which many preemption bills are passed could violate procedural requirements that are established by state law. Other preemption laws may violate the federal constitution. For example, in the Birmingham case Kim mentioned, the court ruled, as she said, that the state's preemption of Birmingham's minimum wage could be found to be racially discriminatory, and that's a violation of the Constitution's Equal Protection Clause. Some of the punitive preemption laws punish local government officials for how they vote, for example, could violate the First Amendment, which, as I'm sure you know, guarantees freedom of speech. There's right now a lawsuit in Florida challenging punitive preemption with respect to gun control, and that lawsuit has raised just such a First Amendment argument, as well as other constitutional arguments. There are a number of lawsuits pending right now that are testing these and other legal arguments against preemption. So while it can be difficult and expensive to challenge these laws, it's certainly not impossible, and we're definitely see that playing out in real time right now. So with that, I want to hand it over to Miya to talk about her work looking at the intersection of preemption and equity issues.
Thank you, Sabrina, and hello, everyone. My organization, the Partnership for Working Families, is a national network of 19 local organizations across the country that are helping drive community-led change through multiracial organizing and coalitions. They're working on raising the minimum wage, passing paid sick day ordinances, creating local tenant protections, and fighting for community benefits agreements. Preemption, or what we call state interference, is a direct threat to our whole model of locally created progressive change. We've come to focus on two main strategies challenging the state interference. One is to highlight the impacts of state interference on people of color, women, immigrants, LGBTQ folks, low-wage workers, the poor, and other targeted and vulnerable communities. And two is to unmask the corporate actors behind state interference, zeroing in on corporations that have poured limitless amounts of money and wielded incredible influence over our state governments. In many cases, such state interference laws are being used as a tool through which largely white state legislatures both deny cities made up of people of color their right to self-determine and also preserve long-standing racial inequities, which I'll get into shortly. So at a time when our country is reeling from the blatant racism and violence and misogyny unleashed by this administration, it's through these lenses that we're confronting and unpacking the corporate role in the tactics to advance white supremacy through state interference. To help shed light on these developments, we created an interactive map you can find on our website for workingfamilies.org/preemption map, where you can see which states block local laws on issues relevant to social determinants of health, including jobs, wages, housing, and protections for immigrants and the LGBTQ folks. The map helps us to see the bigger picture and chart some pretty disturbing trends. One being the extent of corporate influence and capture of state legislatures. There's already lots of data on the incredible spending by corporate interests on state legislative candidates and lobbying. And we now know how they are getting results. 25 states now prohibit local minimum wage. 27 states now prohibit rent control. But the big corporate winner? Uber, which has gotten 41 states to prohibit local regulation of its industry. How did they do it? We looked into this question extensively with our partners at the National Employment Law Project, and I want to share a quick clip summarizing our key findings about Uber's aggressive lobbying tactics.
In today's world, this is quickly being replaced by this. But ride-hailing corporations are using the sinister tactics of the gun and tobacco industries to buy political influence and preempt or override local policies. In 2016, Uber and Lyft had more lobbyists than Amazon, Walmart, and Microsoft combined. That means they can rewrite the laws to benefit themselves, which means a lot less protection for consumers and drivers, who in many cases are scraping by on less than minimum wage. Rideshare companies often barge into local markets, sometimes illegally, spending large sums of money to quickly develop a customer and driver base. Then they deploy an overwhelming number of lobbyists. From there, they bully elected officials with ultimatums, threatening to suspend service if they try to adopt protections for drivers and consumers. They might also bamboozle customers to take political action, frequently by misrepresenting the facts. So what does all that money and influence buy? 41 states have blocked cities from passing their own rideshare policies. So maybe it's time we replace this with this. Learn more at uberinterference.com.
Another big takeaway is that the corporate interests behind these state laws, like ALEC, the National Restaurant Association, and Uber, aren't just trying to limit local laws, or as they like to argue, avoid a patchwork of regulations. They're trying to clear the field of anything that protects workers, consumers, or tenants. We know this because when we look at the states that are saying no local regulation on an issue, we can also see that those same states refuse to do anything about the issue themselves. Of the 22 states that prohibit local paid sick days or other employee benefits policies, how many of those states do you think have any state-level requirements for employee benefits? The answer is 4. Of the 27 states that prohibit local rent control, a big fat 0 have any state-level provisions dealing with rents. You get the picture. Many states that have preempted minimum wage, affordable housing, and other worker protections involve overwhelmingly white state legislatures taking away the power of majority people of color cities to protect the basic livelihoods of their residents. Let's take a quick American history lesson on some data we came across when we were drafting our amicus brief with the Southern Poverty Law Center for the Birmingham minimum wage preemption case. Going all the way back to the early 1900s, employers across the South brought Jim Crow segregation into the workplace, separating black and white workers, keeping black workers out of higher skilled positions, and paying black workers dramatically lower wages. Today, in 7 major American cities with majority or near majority African American populations, including cities outside of the South, we find shockingly similar racial wage gaps among the lowest paid workers. Black workers in the lowest paid occupations earn on average across these cities 80 cents on the dollar of their white counterparts. Each of these 7 cities attempted to raise the wage for the lowest paid workers, an action that would have in many cases completely closed the racial wage gap and put African American workers on a path out of working poverty. Birmingham and St. Louis passed ordinances to raise the minimum wage citywide. Atlanta proposed, and Durham and Memphis passed ordinances that raised the minimum wage for workers employed by city contractors. And coalitions in New Orleans and Cleveland built public momentum to place minimum wage measures on local ballots. However, these cities all fall within states with legislatures whose racial makeup is on average 80% white. In each case, these overwhelmingly white state legislatures responded to the city's action by prohibiting local minimum wage raises, in some cases forbidding a wage increase to appear on a local ballot, and in others reversing local wage raises already in effect. These legislatures are using state preemption to sustain the legacy of the Jim Crow racial wage gaps. And as many of us know, the consequences are even more complex and severe when you look at how women, particularly women of color, are experiencing them. In a brief related to the litigation in Pennsylvania regarding whether the Pittsburgh Paid Sick Day Ordinance is preempted, our research with the Women's Law Project highlighted that women who still labor under a persistent gender wage gap make up the majority of low-wage workers. They bear a disproportionate share of family caregiving responsibilities. In 29% of African American families with young children, the primary provider is a black woman. and women are less likely to have paid leave to take care of their families or themselves. For poor families, having to miss work or even lose a job because of missed work can mean financial catastrophe. Across the country, state legislators are 76% male and 75% white, and the whiter and the maler the legislature, the more they deny cities the ability to protect their people. The two states with the most state interference, Tennessee and Indiana, have legislatures that are almost entirely white and male. Those are also among the 5 states that prohibit local measures to create equity in hiring, like local hire or ban the box for formerly incarcerated people. And they are among the 8 states that prohibit local protections for immigrants, like sanctuary city laws. And this is just scratching the surface. We are currently expanding this race, gender, and corporate capture analysis in other regions of the country and would love to be in touch with folks on this webinar about preemption in the context of public health and equity. Thank you.
Great. Kim, do you want to talk about some resources to address preemption?
Sure. So a lot of folks have been asking, how do we talk about preemption? Where are folks in terms of voters and the general public? What do they know about this issue? And the answer is really not much. But there are definitely ways to let voters and the general population know they have a stake in the outcome of pushing back on these laws and the impact of these laws. So, I think this is not new news to most people on the call, but, voters have a much higher opinion of local government than they do of their state government, and certainly than they do of Congress and the federal government. So if you look here at the far right column, you'll see that 63% of the people polled in a national poll in January of this year felt positive about their local government. Only 28% felt positive about the federal government. So they do, as Sabrina said, feel that the local government is closer to them. And it's best able to reflect, the uniqueness of their community, their own views, their own values. They know best what the needs are. So, the top argument in terms of pushing back on preemption and state interference in preemption, in local lawmaking is that local governments are more connected to the needs of the community and therefore can pass policies that reflect their community's values. People also understand that at the state capitol, the lobbyists have what they consider to be undue influence. This is a meme and a theme that they already readily buy into, and that voters believe that preemption happens or state interference happens because lawmakers are being pressured by industry and corporate lobbyists to preempt localities from acting on policies that would affect their bottom line. And so that is not a new concept either. Voters are deeply concerned about the consequences, particularly on workers, public health, and protections. The way to help people understand what the state interference in their local lawmaking really affects is to bring it home, to make it about their lives. It is about where fracking sites can be situated in terms of proximity to schools. It is about air and water safety. It is about the ability to protect workers in the workplace and to have policies that improve the lives of local workers. So the consequences are immediate and they're personal, and this is a way to get around the fact that preemption is actually a process. We're not opposed to preemption. Preemption has been used for good. We are opposed to the abuse of preemption and the use of state interference to keep lawmakers at the local level from acting on the benefit their constituents. So in terms of the messages, local communities know best how to meet the needs of the people living there. It is wrong for the state government to come in and dictate to local people what is best for them. Also has to do with the economy. Local communities pass policies to help their local businesses thrive and create an economy that works for the people who live there. When state lawmakers prevent communities from passing economic policies that work for them, they hinder economic growth and development. And then the final message in the sort of trio of messages that in combination work best, it has to do with gridlock. I mean, people understand that the place that policies are moving is at the local level, that nothing's moving in Congress and very little is moving at the state level. Sadly, political gridlock and corporate special interests have made it harder to get things done at the state level. At least at the local level, we can make our voices heard and demand change and accountability from people we see every day here at home. So in terms of making the case, you do want to start with normative values. That is about the agency and the belief in local government. It knows our needs and our values best. Introduce the policy imperative. What is it that we need local government to enact? Who is stopping us, identifying this threat? All right, and what will happen if they do stop this policy from moving forward? What are the negative consequences? We are going to give you a few do's and don'ts quickly, but you know the number one piece of advice is to fight values with values. Remember that we started with in the first part of the presentation with a quote from Texas Governor Abbott talking about the need to restrict local regulation, and the argument they make is because local control is oppressive. It impairs the liberty and freedom of businesses and individuals to act on their own and actually hamstrings them. What we want to do is counter their claim and their ideological embedding of their reason to preempt with the values of local democracy, local authority, and local leaders, again, ability to best meet the needs of their community. So this is about local agency. Give examples of preemption's negative impact. One of the things I will add here is that communities in the polling do believe that discrimination is a negative impact on their community, that they understand when there is discrimination against people of color or LGBTQ folks, that is something in their community that doesn't reflect their values and actually is damaging. Do assign motive. This is about language. So we don't talk about preemption. We do try to use the term state interference or state intrusion, because really what this is a usurpation of a normal process, in one of the three levels of government that's now not being allowed to function as it was designed to function. Talk about the misuse or abuse of preemption. Again, preemption is not the enemy. It is how it is being used now. Use the terms local democracy, local control, local authority, and then remind voters who's behind this, deep-pocketed corporate special interests and their lobbyists. And then the don'ts are try not to make this a partisan issue. It really doesn't ring true with both experience and with voters. I mean, we have seen, both parties use preemption since 2011. Don't make this a process discussion. This is really, we want to focus on outcomes. Don't disparage the role of the state government. People do believe the state government, back to Sabrina's point, have a role in this, okay? And that is to set a floor and then encourage or allow cities to do things that are more reflective, to act on that floor, to do things that are more reflective of their local community's needs. Don't overheat the language. If you start using language about attacks on the cities and war on the cities, the voters, don't believe it. They think if there's a war going on, they would have heard about it. They would know little about state interference in their local democracy, and they especially don't see it as a war. And then we're going to talk, don't accept the patchwork argument. I think that you all hear this argument all the time. We want uniformity, that it hurts businesses to have different laws in different cities inside of one state. But actually, there is no proof that that's true. And in fact, businesses work all the time with different health standards, different taxing standards from city to city and county to county. And then finally, if they really did want uniformity, they would pass good, strong statewide bills. So a little bit about resources. We do provide technical assistance if you have questions or want help. We have a legal hotline. We also have a variety of resources up on two of our partners' websites. at the Fordham Urban Law Center and at A Better Balance. And there you will find, we have done an update of all 50 home rule provisions, for example, and case law attached to that. You will also find theories of how to fight back using litigation, and I think you'll find them very useful. Also, this polling and messaging is up on both of those sites. Sabrina?
Great, thank you to both Kim and Miya. I want to dive straight into questions so we can maximize our time. I see some already in the chat box, but if you have additional questions, please feel free to type them there and we'll get to as many as we can. So I'm just sorting through these questions. Kim just mentioned, but I wanted to just reiterate because there was a question about whether the research you just went through is publicly available, and I think the answer to that is yes, it is at those links that Kim shared, and these slides will be distributed to everyone that registered for the webinar. Is that correct, Kim?
Yes.
Great. Okay, so there was a question from earlier on, which I think you answered in the chat box, Kim, but just so that everyone is on the same page about why 2011. You flagged 2011 as a date. Can you just talk briefly about that?
Sure. So we had a sort of confluence of two things. One of them is that we saw, frankly, one party take over after the 2010 midterms. We saw one-party dominance in many, many, many more states, what we call a trifecta. Frankly, the Republicans took over governorships and both houses of the legislature in almost twice the states that had seen a trifecta before. So it basically went from 14 states that had a trifecta before the 2010 election to I think 24, and it's even greater now since the 2016 election. So there's that, and then frankly, Citizens United ruling, which really opened the pocketbooks for corporate giving. We've seen a 600% increase in donations to political candidates and PACs since the 2010 Citizens United ruling. And as Sabrina and Miya said, I mean, that money goes to influence what happens at the state capitol.
Thank you. I'm not sure if either of you have information on this, so I'll turn this to either of you, but someone asked if there's any information on preemption laws impacting specifically older Americans. Either of you have any insight into that?
I don't know. I don't.
Yeah.
This is Miya. Thank you for the question. We're looking into older Americans who are impacted by affordable housing preemption, specifically in Colorado, Tennessee, and other places that our affiliates are working in. And it's been pretty devastating for folks who have been living on a fixed income and paying, certain rent and affordable rent for many, many years with no control on the rent that they're paying, and their city being preempted from implementing any controls. There has been a lot of devastation, and so we're kind of exploring this more right now. But I'd be happy to be back in touch with whoever asked that question.
Great, thank you. This is probably a question for Kim, but either of you should feel free to jump in. Does who you partner with on a campaign help your messaging when it comes to preemption campaigns? Is there an ideal type of messenger or messengers needed to challenge preemption or to send out these messages that you were talking about, Kim?
Yes. So what we are trying to do, I mean, frankly, what has been happening is it took a while, for folks to catch on, because this was, the activities engaged around issue by issue by issue preemption made it hard to connect. I mean, we were looking at fracking preemption and minimum wage preemption and plastic bag preemption and puppy mill preemption and, soda sweetened SSB tax preemption. And really, it then, took some connecting of the dots to realize this was actually, a cross-issue attack. And the idea was much larger, and the agenda was much larger than we had been addressing it as a community. And so what we try to do now, and we are working in 10 states to build coalitions, cross-issue coalitions, that include folks from the environmental community and the civil rights community and social justice and women's rights. And, again, so, and our point is that, some of this has been used to sort of exacerbate the divide between cities and rural areas. But really what's going on is when a city loses power, period, around any issue, smaller towns and localities also lose the same power. And frankly, what we've seen is that once this power starts to erode, lawmakers, state lawmakers are not as, they don't hold back. So it's, that's why we're seeing the Death Star. And then with, the bill in Pennsylvania right now would undo 40 ordinances all at once, many of them wage and benefit, but also looking at undoing the Philadelphia's paid sick days bill, which has been on the books since 2015. And so what we are trying to do is use a cross-issue coalition there to fight, the loss of all of those ordinances and local powers.
Yeah, I would have something to add as well. I think there are two ideal messengers. I mean, there are many, but the two that I would like to focus on are, one, state lawmakers, like Kim said, and then two, the general public. So for state lawmakers, what we found through a lot of our research, especially related to the report we did on Uber and Lyft, was that they were overwhelmed by lobbyists from Uber, from corporate associations and industry, and they were essentially bullied into or pressured strongly into authoring and voting for legislation that oftentimes came directly from Uber lobbyists. And preemptive language was often slipped into these bills, sometimes without, sometimes we would circle back and they would say, oh, I need to, I didn't realize that this was the implication. And so the bill could be on any number of issues, but preemptive language often gets slipped in, and that's a huge problem. So I think it's really important to inform and educate our state lawmakers on what's happening and this tactic being used by industry right now. And then two, the general public, just engaging the more people that can understand that this is an issue that impacts them across cities, regions, localities. We're trying to just educate and inform local communities about what a big deal this is. Thanks.
Thank you. So there's a question about what we know about the sustainability of different types of preemption laws and whether there are examples of states terminating and replacing preemption laws, for example, after a new governor and state legislature are elected into office. I can say really briefly, and then either Kim or Miya, if you want to jump in and say more, that yes, there are definitely examples of that. For example, the tobacco control movement has been pretty successful actually at getting some preemption bills or laws, I should say, that were already in place repealed later down the line. As I noted in an earlier slide, there's definitely that can be done both through the legislative process, but also depending on state law, sometimes through ballot initiatives. And we are really seeing that some of these laws are vulnerable to legal challenges. So that's not the legislative process necessarily, that's the judicial process, but there is definitely that pushing back happening now. So it really depends, I think, on the specific law and also on who the players are. But Kim, do you want to, or Miya, do you want to add anything to that?
Just quickly, I mean, we are looking at, what would happen, what structural changes could happen as a result of the midterms. And so there are places like Colorado as a prime example where, a repeal of the minimum wage preemption in Colorado made it through the House in the 2018 session this spring, but was killed or died in the Senate. And so if the Senate flips, there is a possibility, frankly, that this repeal could make it through both houses, and then minimum wage would not be repealed, and localities of Colorado could do whatever it is that they want to have reflect the views, values, and needs of their own community. And so we are looking at a variety of places where the situation could change as a result of the midterms, and where we could push more offensively and aggressively.
Great, thank you. Did you want to add anything to that, Miya?
I don't think so. Thanks.
Okay. Maybe Kim, if you can answer this one very quickly, then we can wrap up. And this is about the recommended don't make this a process discussion in your messaging slides. Can you just talk a little more about what that means?
Sure. So frankly, I mean, people are not versed in the tug of war between state and local powers and who should have control over what. I mean, if you remember from the polling, we really need the public messaging that you do to be about consequences and the effect on individuals, on classes of people. You know, what harm does this do? And in case of good preemption, what good does this do? But if you're focused on the process, you're missing the opportunity to educate people about the outcomes, which is really what gives them a stake in this conversation.
Great, thanks. So there are a couple other questions here that we're not going to have time to get to about specific subject matters like tobacco, food, etc. And you will see in a second that we have included our contact information, and I would welcome some exchange via email or on the phone about some specific topics if folks have questions, so we can follow up with you individually. Next up in our series is our final episode, which will explore the complexities of aligning community interests with local government policy agendas. The blog post explores effective strategies that local governments can use to promote community engagement and public participation in 4 key government functions. You can read that blog post now by visiting the series homepage, which is on this slide. And then you can join us on October 30th for an all-in-one webinar and interactive panel in which experts will discuss the complex but essential process of ensuring that community voices are heard in the public decision-making processes and answer your questions in real time. So you can register now, also on that same page. If you are looking for additional resources on preemption, in addition to the resources Kim listed, ChangeLab Solutions has several on our website. This slide shows 4 of our primary resources. So they range from a simple explanation of preemption to information on how to spot preemption or deal with it during the legislative process. Some of these materials are several years old, and we're hoping to update and expand on them. So we are really eager to hear from all of you about the sorts of resources that would be most useful to you in your work. So please feel free to include that information in the evaluation survey or to contact me directly. Likewise, feel free to reach out for technical assistance on this topic. We're here to help. And I wanted to note one other resource that we have, which is part of what's called the Public Health Law Academy. We have a full training on preemption just as a concept. It doesn't go into some of the politics and more recent developments as we did today. It's more along the lines of the constitutional and legal framework, but that's available to be viewed in real time at any point. It's a project we worked on with CDC, and you can find a link to that on our website, or if you Google Public Health Law Academy, that should come up. There are trainings on other topics there as well. So as I mentioned, we are happy to share our contact information. It's here. You are welcome to share thoughts with us, ask questions. As soon as this webinar is over, you will be directed to a very quick follow-up survey that I just mentioned. So please just take 2 or 3 minutes to share your feedback with us. Helps us shape this conversation. And like I said, I'm specifically interested in what types of additional resources on this topic you would find useful for your work. The recording for the webinar will be available soon, so you will receive a follow-up email with a link to that and to the slides. I want to thank everybody for joining us, and particularly thank Kim and Miya for sharing their insights and joining the conversation. And we hope to see everyone on October 30th for the next episode on how to advance health equity through community power. Thank you.